I feel that people with ADHD are dissociating in a fairly minor way a lot of the time. Why do I feel this way? Well, to answer that question, I need to explore what is dissociation in the first place and why does that happen. Let's look at the most extreme case of dissociation. This is what we see when someone has DID. And the people who go on to develop DID, dissociative identity disorder, are the people who have the most severe trauma. Their trauma is so severe that they dissociate just to cope. And they go on to develop alters, their identity essentially splits in order to cope. So that's how much they need dissociation. The reason why I feel that people with ADHD dissociate, but in a much more minor way than in the extreme trauma disorders, is because I believe that ADHD is a trauma disorder. Now, people would often argue that people are born with ADHD, and I would say, yes, people can be born with ADHD because of the stress that they pick up when they're in the mother's uterus. So a genetically highly sensitive person can pick up stress before they're even born and go on to develop ADHD. I believe that I developed ADHD at 8 years old. I have very specific memories around developing ADHD. I remember going from a child who didn't daydream to one who very much daydreamed after a distressing incident. Because I have strong memories of developing ADHD, I am of the mindset that ADHD is developed when a highly sensitive individual experiences a certain level of stress. I believe that people with ADHD dissociate because I believe that ADHD is a trauma-related disorder. And when someone has trauma, they learn to dissociate in order to cope. I believe that we are allergic to boredom, as well as other types of emotional fluctuations. So we're constantly trying to regulate, and that's why we dissociate. We daydream, and that's a form of dissociation. We hyperfocus, and that's a form of dissociation. We go into our head, and that's a form of dissociation. We have an overly active mind, and that's a form of dissociation. In order to regulate and in order to dissociate less, we need to practice grounding exercises to bring ourselves back to the present moment so that we don't need to dissociate so much. Because the trauma that we experienced that led us to have ADHD is no longer there anymore, but we're still using the old strategies of dissociation that we used to survive in the moments of distress when we first started having ADHD symptoms in order to cope.